Welcome back once again to Recovery Coast to Coast, America's nightly voice for recovery. It's great to have you joining us tonight. We are on the air till midnight tonight. Jim Vollendroff has been nice enough to come down, and I want to talk about Jim. I want to talk about the man in long-term recovery. Now, you are the Director of Behavioral Health and Recovery Division in King County. You come into that as a person in long-term recovery. Take us back and introduce us to Jim and a little bit about what it was like for you.
Thank you, Neil. I will. And one of the greatest privileges of my life is the job that I have and to be able to use my lived experience to help advance public policy. And I'm committed to bringing more people with lived experience into public policy. And as the director, that's been something that I've been most proud of is when I look around the division now and I see some of our new hires and see how many more people we have with lived experience in the division. My recovery actually began as an adolescent, and my recovery was mostly on the mental health side as a young man, and some struggles that and my parents, we have a long family history of addiction, as many of us do. And eventually I found myself deeply depressed and isolated and fearful and really unsure about what the future would hold for me. And I ended up attempting suicide multiple times as an adolescent.
How old were you the first time?
I believe, looking back, I was probably 15, 16 years old.
What precipitated that?
Well, it had to do with the fact that my parents divorced. We moved from California to Washington State, and my mom's intent was really to improve our lives. We were living in a alcoholic household. There was abuse of many different kinds going on, to which I don't know the extent today. I mean, it was a bad situation.
You have brothers and sisters?
I have 7. There's 7 siblings.
Wow.
But we have a large family. My sisters were all older at that time, so my mom moved up here with her 3 sons still living at home. And again, my mom's intention was that our life would get better, but I was holding on to a deep secret at that particular time. And I was dealing with my sexual orientation, not knowing how to handle that. And as opposed to having anybody to talk to, I chose to internalize that and felt like I would be better off dead than alive.
Oh, my goodness.
Yeah. And so that went for many years. I went through struggles and had multiple attempts at suicide as a young person. And I have actually been involuntarily committed in our mental health system as a young man.
How old were you then?
15 or 16 years old. I was a patient at 7 North here at the University of Washington Hospital several times. And ironically, I live in that neighborhood now, and I drive by that place every day. And there's such a sense of empowerment of having come from this dark place of wanting to end my life to getting to a point where I'm the director of the behavioral health division of this community, and I now live near this hospital in which I was involuntarily committed. So it's incredible, full turnaround that I experienced.
When did the recovery begin for you?
Well, the recovery began for me following my hospitalizations, and not my substance abuse recovery. That came much later in my life. My mental health recovery, I see myself as an individual who's in recovery from substance abuse and depression and anxiety. Those are the kind of conditions, the comorbid conditions that I live with. And I live with it today. I live with it every day. My recovery is an ongoing process.
One day at a time.
Exactly, one day at a time. And sometimes I find myself, I'm feeling a little depressed. I need to do certain things. I've got anxiety. I know what the tools are, and I know what I need to do to maintain that balance in my life. But it is an ongoing process and something that I live with every single day.
Jim Vollendroff joining us tonight on Recovery Coast to Coast, talking about his journey, which, as you're telling your story, I immediately think of Michael Botticelli, a gay man in long-term recovery who rose to the top nationally as the drug czar in the United States. When did you decide that you wanted to give back?
Well, that actually started early on. I was kind of trying to decide what I was going to do in terms of a career. At this time when I was younger, I realized that it was okay to be gay. And once I realized that was really a turning point in my life. I still had some struggles. I still live with depression and anxiety. I still needed to find long-term recovery from substance abuse later in my life. But I started working at a detox center when I was a young man. I didn't even know what detox was, frankly, at the time. I just knew I needed a job, and I took this job. And so I worked in detox, and then I just rose through the ranks and along the journey found substance abuse recovery and have always wanted to give back based on the fact that I have a family history of addiction. I've got siblings who are in long-term recovery. It's just been something that's been a part of my life.
You have siblings in long-term recovery.
I do.
It is a family disease.
It is a family disease. And
My goodness.
Yes, I've got nephews and nieces now in long-term recovery.
Oh, that's wonderful.
So,
that's wonderful. What is the family reaction been to Jim's recovery?
I think that I have a tremendous support from my family. I think that some of them have been mentors for me, and I've been mentors for some of them. So some of them led the path before I got into recovery, and some of them now see me as a role model.
What are some of the challenges for a guy in long-term recovery coming into this field?
For me, it's a hard job, Neil.
Yeah.
This is a hard job, and there are a lot of things coming at me all the time. And I stay focused on the fact that we are here to improve the lives of people with behavioral health conditions. And as long as I stay focused on that, I thrive in my position, and I think that I enjoy it a lot. But there's a lot more to it. There's funding struggles. There's crises that come up. And I always have to maintain my own personal balance and make sure that I don't
How do you do it?
Well, yeah, that's a really good question. And I think for me personally, I surround myself with people in recovery, people in long-term recovery. I have confidence that I can call. I have people that I can go to. I am not also shy to seek out therapy when I need to. You know, I always tell my staff, if we can't practice what we preach, we talk about reaching out and accepting help. When I need to, if I need to go reach out to a therapist, I'm happy to do that to maintain my balance. So I try really hard. I also take care of myself physically. You know, I'm a man who runs, and running has become a big part of my recovery.
Oh, I love it.
Yeah, it's really become an incredibly important part of my recovery.
I haven't missed a day of running in 12 years.
Oh, good for you.
Yeah.
That's
Not that I'm
exciting.
compulsive, of course, but that's the way that it goes. Jim Vollendroff joining us tonight on Recovery Coast to Coast. In terms of your substance use disorder recovery, when's the last time you had a drink or a drug?
It has been 17 months at this particular
Wow. And it's one day at a time.
It is one day at a time.
My goodness. And again, you're surrounded by community. That's the thing that I keep trying to get through to our listeners. You don't have to do it alone.
You don't have to do it alone. As a matter of fact, if you do it alone, I think that you are destined to have a lot more challenges than you otherwise would. And I've been so blessed by people throughout my entire life who've been supportive and who understand this is a progressive disease. This is a disease. It's not a linear thing. You don't get into recovery and all of a sudden things are automatically better. As a matter of fact, sometimes people relapse. Sometimes people have to, experience relapse as a part of their recovery. And, it is a process that I will always be involved.
Yeah. We often use the term relapse prevention in this field. I don't use that anymore, Jim. I use the term recovery enhancement because just as addiction is progressive in a negative sense, it should be progressive in a positive sense.
I love that.
That is what recovery is all about. Recovery enhancement. You need to be better today than you were yesterday because it is all about today. Yeah. And as far as time is concerned, the person who woke up this morning the earliest has the most recovery.
That's right. That's
Jim Vollendroff is joining us tonight on Recovery Coast to Coast. Your family has been very supportive of your recovery.
Yes.
And you have siblings and you have nieces and you have nephews and all of that. How does that make you feel?
It's the greatest joy in my life to see my family members who are in recovery and who can see me take a different path in life. I have a sister who's going on 20 plus years of recovery, and she really was the first member of our sibling group to get into recovery. And then it's just been terrific to see nephews and nieces. I've got two nieces in recovery and one nephew who is in long-term recovery. And, it's incredible. It's changed our life. It's changed our conversations when we get together at Thanksgiving, and, it's incredible.
And the whole lifestyle changes.
Yes, it does.
Because, when people get well, the only thing they need to change is everything.
Yes,
is,
exactly.
is everything. Jim Vollendroff is joining us tonight on Recovery Coast to Coast. He's a guy in long-term recovery. Did you go through treatment for alcohol and drugs?
I did not go to formal treatment. I've been in therapy and
Mm-hmm.
have gone to therapy, but I did not go to formal treatment. And that's a really important, actually, conversation to have. There are many of us out there. There are a lot of us. I was a very high-functioning alcoholic, if you would, and I know many high-functioning people in high-level positions who were struggling just like me. I knew a lot of them because I gravitated toward those people in my drinking days. You know, we would go out after work, and I recognized following a significant issue. I struggled with it for many, many years, and I always felt, well, mental health is my issue, not drug and alcohol.
Yeah,
it's
of course.
mental health.
Yeah, no denial there, right?
Exactly. Classic. So I always, made concessions in my own mind that it was really about mental health. And, I had an incident in my life in which alcohol played a part, and the consequences were so bad that I couldn't deny it any longer. And I reached out. And I got help, and have been sober ever since.
And working a program of recovery one day at a time.
One day at a time.
What do you say, Jim, to somebody, and if you're just joining us, Jim Vollendroff is our guest tonight, Director of Behavioral Health and Recovery Division of King County. More importantly for the segment, he's a guy in long-term recovery. What do you say to someone who said, I've been through treatment time and time again. I've tried. I can put together maybe a week, 2 weeks, a month, 6 months, a couple of years, and go back. What do you say to that person?
I say that you keep trying and you never get up. It's only those that continue to try that eventually become successful. And it's difficult. You reach out. You become a part of a community. One of the things I'm convinced is that individuals who are struggling have lost a connection. And one of the things that has been helpful to me and countless others is finding a recovery community and finding that connection with other people in long-term recovery. And that if you give it enough time and you give it enough space and you reach out, you become a part of this community, that you can eventually get there.
Jim Vollendroff talking about recovery, talking about his own personal recovery. And he is the Director of Behavioral Health and Recovery Division of King County. What about the legislators, the people you work with, and how they view you as a guy in recovery? I mean, you've walked the road.
Yeah, I've been incredibly fortunate to have great relationships with people in the Washington State Legislature who understand the work that we do and understand the challenges. And I think that there is a certain level of credibility in recognizing that somebody who's there in front of you has experienced behavioral health conditions. And mine go back a very long way. It started as an adolescent, and the progressive nature and the fact that I am willing to talk about it. Neil, I worked in this field for 30 years before I was able and willing to even talk about my mental health recovery.
Wow.
And it was a stigma. I was afraid. I was fearful.
That's a giant stigma. But when you're working in the field and you've got this shame and you've got this secret and you've got this denial.
Well, and I had this hidden layer of struggling with my drinking at the same time. Again, I was really focused on, I was mentally ill, and I've gotten better from this mental illness. Well, part of the way that I was managing that mental illness was by drinking. And so in recognizing that, it's just been, I really feel like I've got quite an incredible recovery story, and I am proud to be a part of the recovery community here in King County.
What about the role of NAMI? Did they help in your mental illness?
Well, NAMI is a great community partner for us, and certainly I know many people who have been members of NAMI, and they provide a critical resource to family members. My family members, I don't know if any of them participated in NAMI meetings and that kind of support. I do know that my parents reached out to a number of people, but back in the day, I really wasn't in a place to pay attention to who those folks were. But I'm sure that NAMI's played a part in my recovery.
Who's been the most significant person in your recovery?
I'd have to say that it's been my parents, my biological mother in particular. My biological father, not so much, but my mom remarried and I was adopted by my stepfather. And so my stepfather and my biological mom have been probably the most incredible. They're the kind of parents who never gave up. And that's one thing that I would suggest that people don't give up. If you give up on somebody, it makes those challenges even more difficult. Not to say that somebody who doesn't have family support can't get into recovery. I've seen that happen. But the fact that my family never gave up on me was incredibly important to me.
You must have seen and continue to see miracles along the way.
I have, and I see them every day.
Yeah.
In my own recovery, I write them down. I write them down as I see them, and when I'm struggling, I pick up my journal and I look at the things that I've written down. I'll give you a quick example. One time I was in Missoula, Montana, and I was there for a football game. And so I'm in Missoula for a football game, and I ran into somebody, and she handed me a book that I had been thinking about buying for a very long time, and I'd just never done it. And it was this miracle of recovery that occurred that helps me stay grounded in the fact that this is bigger than I am. This is much bigger than I am.
Mm-hmm.
And those happen all the time. And, those are incredible events that keep me grounded.
I call them God incidences. They're not coincidences. They're God incidences.
I love it.
Yeah.
That's exactly what they are.
Yeah, and it's all about one day at a time, and stuff happens in recovery.
Yes.
When you find your way into recovery, the problems don't go away. Life doesn't go away, but you're better able to deal with these things.
Yes, that's true.
Yeah. What advice do you have for someone listening right now, again, who maybe in King County, maybe anywhere? What's the first step? Reaching for the phone, reaching for the computer?
Yeah, either one. We've got lots of resources here in this community. We've got the recovery helpline here in this community. We've got the crisis clinic. We've got the hotlines that are available.
Yeah.
We have a rich recovery community in terms of recovery support groups. So there's lots of opportunities.
And the Recovery Cafe up the street.
The Recovery Cafe.
I
One
love
of my
that
favorite
place.
places.
Isn't that great?
It is. And this may sound interesting to you, but as the director of the Behavioral Health and Recovery Division, I've taken a class at the Recovery Cafe.
Wow.
I love it that much that they had a class and it sounded interesting to me. And I thought, you don't have to be, there's no stereotype of who takes a class.
Right.
And so there I am, and it was an incredible experience.
Yeah, check out the Recovery Cafe if you live in the Seattle area. It's absolutely amazing.
Yeah, just one last thing about the Recovery Cafe. Last Christmas, my parents were visiting from out of town, and the Recovery Cafe had a Christmas Eve service. I took my parents there, and we sat
Jim.
with the recovery community. It was an incredible event. My parents still talk about it.
Wow. Jim Vollendroff joining us on Recovery Coast to Coast, a guy in long-term recovery from mental illness, from substance abuse, from alcohol and drugs, and now he has risen to the guy who leads the charge, the senior leader in King County's Department of Community and Human Services as the Director of Behavioral Health and Recovery Division. When you got that job, what were the feelings that went through Jim's mind and heart?
Well, I was incredibly proud to be given the opportunity to lead this effort, especially at a time of historic nature, with the transformation of the Affordable Care Act and the integration efforts that are taking place, the infrastructure development that needed to occur in this community. We have a lack of inpatient involuntary psychiatric beds. We have a lack of ability. 60% of people who need substance abuse treatment in this community have to leave King County to get treatment. That is just unconscionable.
Disgrace.
It is, and we've got to do something about it. And we are. We've added 2 new evaluation and treatment facilities. We have new substance abuse residential programs coming on. We've opened 2 recovery high schools in this community, something I'm extremely proud of.
Yeah.
I used to say, if I can open a recovery high school, my job will be done here. And we've opened those. And, of course, I see new opportunities as we've done that. But it comes from having struggled in high school myself and recognizing or sending kids to treatment and recognizing they come back to using environments. And it's been incredible.
Yeah, you had a rough adolescent. I remember a guy came into my office years ago, and he'd written a paper called On the Road to Nowhere, Alienated, Isolated, and Drunk. He was a gay man who was struggling and didn't know where to go and where to reach out. Now, today, there are so many services available.
We are so fortunate.
And so you need to take advantage of what's available. And boy, there's a plethora of wonderful opportunities here in the King County area. Jim Vollendroff, an amazing man with an amazing story. He's a guy in long-term recovery, and I appreciate you sharing some of that story with us tonight.
Thank you. I appreciate it.
Jim Vollendroff, I wish you continued success one day at a time and one political issue at a time as well, I guess.
Thank you, Neil.
All right. I'm Neil Scott, the program Recovery Coast to Coast.